Hi everyone, this is Ryan Hoyme, aka Massage Nerd, and right now I have Lauren from Healwell. Welcome, Lauren.
Hi Ryan, nice to see you.
So, what do you think of the Congress so far?
It's been amazing. It's really it's great to see all the educators and school owners and administrators, accreditation agencies, and everybody really coming together to talk about, real issues that are facing our profession and some of the solutions. And I think we have some hard work ahead of us as a profession to really stay relevant and provide real career opportunities and provide a real foundation of education for people coming into massage school and then trying to go out and find jobs and make a difference with that work. So
yeah, definitely. I mean, every Congress and stuff like that, it's getting a little bit better.
Yep.
So
and it's nice to see all the different stakeholders in the profession sort of talking with each other and really saying, yeah, these are the problems, and it's time to really start to look at them and
doesn't necessarily they don't agree on everything,
exactly.
But at least everybody has a voice here.
Yeah, and it's
nice
almost,
about it.
I'm kind of glad when I see disagreement, because I think that's when real solutions can emerge, and when people can say, I think maybe that's not the way to go, but what if we try it this way, and you see compromises, and certainly people get stuck, and then we have to go a different way, but I think that's good. Real conversation is happening when not everybody is smiling.
So what's going on at Healwell then?
I think the last time I was at the Congress, I was actually at the Congress in the capacity of working with the Society for Oncology Massage, and so
and somebody was the president then?
Yes, I was the president at the time. Yes, exactly. And so this year is a little different and fun in a different way for me, because I'm here actually representing a nonprofit. I'm the executive director for a group called Healwell, and we do service, research, and education to really. It's really, at the end of the day, it's about improving quality of life. All of our work is about improving quality of life for people living with acute, chronic, and terminal illnesses. So, we do research in hospital and clinical settings to demonstrate the value of integrating massage therapy and integrative therapies, and we also train therapists. We know that most massage therapists aren't prepared to work in those sorts of settings, and so we offer hospital-based training and classroom training to get therapists kind of bridge that gap between their basic massage therapy training and what do you need to actually be in a hospital setting and to be a contributing member of an integrative team.
Yeah, and for myself, when I went through massage school in the 90s and stuff, they scared us to death about cancer. It's
yes, definitely. And that is the other piece that we do. We do oncology massage training, and we go all over the country, and we're really, looking forward at the next few years. What we want to do, in addition to supporting hospital programs and consulting with hospitals about how to make this happen for them, is really looking at the franchise model and supporting the franchises. I think massage franchise has become a dirty phrase in our profession, and for better or worse, more people are getting massage because of franchises, and we know that those franchises need the support of what we offer and educating their therapists, because we know that without their knowledge even, they are working with people who've been affected by cancer and other serious illnesses, and so we want to reach out to them and figure out how to structure trainings that work for them, so that the traditional barriers, historically when we would approach franchises, they would say, well, we can't close for 3 days to do a class, or not all of our therapists want to learn this, and so at the Congress we've had an opportunity to sit down with some of the directors of those franchise, the national leaders, and say, okay, so we know that this is important to you, and that it's really kind of the business model that's the barrier between you and getting this training for your therapist. So how do we have a real conversation about how to make that happen for you?
Yep, and I think it was mentioned too about even having a few people on staff that really have specialties and stuff like that. Do you think that's adequate and stuff?
Yeah, well, do I think it's adequate? No. No.
Of course, you want
honestly,
everybody.
I would love. I think every therapist in the country needs to know at least the basics of oncology massage, so that they can know how to make a good referral. But I think if the franchises are willing to make a commitment to at least have a few sort of specialists on staff who can work with clients who have taken the time to actually share the information that they do have a cancer history or they're going through treatment. And that's the big piece, is actually educating the franchise owners about the problem is that you can't actually pinpoint these clients until you teach your therapists how to do a proper intake, because you're going to have, if they tell you when they come in that they have a cancer history, great, then you put them with one of your specialists. But what we see happen more often is that someone comes in for a massage who's maybe 5-10 years out of treatment, doesn't mention it until 10 minutes into the massage, and they say, oh, I had 20 lymph nodes removed on the left side, or, you know, I had reconstructive surgery, and then you've got this therapist who doesn't have the necessary knowledge sort of going, oh, and so...
And I can't tell you how many times that's happened to me too and stuff.
Yeah.
I mean, even a woman was pregnant. I mean, she was like 7 months pregnant. She didn't look like it and stuff like that, but halfway through the massage, she says, yeah, it's like...
Yeah, exactly.
It's on the health form, but the thing is, you still got to sometimes remind them. And
absolutely.
But for male asking a female, are you pregnant, it's kind of hard.
Yeah, so I don't envy you that yeah. So, and that's been interesting to bring that to the, you know, a number of the franchises were here at the Congress, and to be able to talk with them about knowing what they don't know, and hearing what is important to them. And quite honestly, a lot of this stuff isn't important to them. You know, they're running a business, they want to make their therapists happy, they want to get good therapists in. So it's part of our job is to educate them about what is a qualified therapist from a practitioner standpoint, from a public safety standpoint, and bringing that sort of closer to the top of their radar screen.
Yeah, exactly. And what's the future of Heal Well then?
Well, you know, we want to take over the world.
And you're very close.
That's right, that's right. With love. No, you know, I think we really want to support the work of the Society for Oncology Massage. We want to work with organizations like ACAC and other groups that are really looking to create a place for massage therapy as a healthcare intervention, and we want to provide training. We want to be a part of that conversation as the profession hopefully moves in a healthier direction, and show therapists that this is a viable career path, and that with appropriate training and appropriate commitment to interprofessional communication and practice, we can really, this can be something where people are going to massage school because they know that they can actually get a legitimate job in a hospital setting, and to be able to participate in the research conversation, and to continue to grow our service programs, because we also, we actually, when we train these therapists, we put them on the ground in our service programs in Washington, D.C. area hospitals and other places around the country. So I would love to see properly trained massage therapists in as many hospitals as possible, and to really get us having a conversation that moves away from an all-volunteer base. You know, when we talk about hospitals have a resistance to bringing massage therapists in, they don't have a resistance to volunteer massage therapists. They have a resistance to paid massage therapists. So how do we change the conversation so that they understand that if you have massage therapists touching your patients, they need proper training, they need to be paid, they need to have access to electronic medical record, they really need to function within your system the way any other patient care professional would. And just so really going in from a place of curiosity and humility and saying, like, this is new. We understand your resistance. Tell us what your questions are, and we'll do our best to answer them. And teach us what's important to your hospital, what's already happening here that's really exceptional, and how do we bring our therapists into that picture to just continue to multiply the amazing care that's already being provided.
And then there's a thing called the Summit that's happening next year. Can you explain a little bit about that?
Indeed. So the Society for Oncology Massage, which is still dear to me, every 3 years they have a gathering of oncology massage therapists called the Healing Summit. So that'll be next April in Minneapolis, here just down the road actually at Northwestern
I'm
Health
okay
Sciences.
with it. Hour and a half drive.
That's right. Perfect. We'd love to have you there. You know, in my previous life, I did a lot of conference appearances working in public relations, and so I have a lot of experience with conferences, and the Summit is by far the most fun conference I've ever been to. You know, usually you have your breakout sessions and people kind of disappear and they go back to their rooms or they go off. We can't get people out of the main halls because it's just like the best, you know, family reunion ever. And people you've been working with through, you know, email and phone contact, or that you haven't seen since the last summit, all come together, and everybody's there because they want cancer to suck less. You know, that's kind of the bottom line, and so that's our uniting force, and just the love and the connections that happen at the summit are really amazing. And I'm going to have the lucky opportunity to close out the event and to do a breakout session, and just to also learn from colleagues and just see what's new in oncology massage. I mean, we do our best at Heal Well to stay on top of it, but you know, there's so much changing all the time that it's just always a really fun learning opportunity, and we make new friends and new connections. And,
exactly. And what's the best way for people to stalk you then?
So definitely the best ways to stalk us are to go to the Heal Well Facebook page.
Okay.
It's just one word, Heal Well. You can email us at info@healwell.org. Come check out our 9-day hospital-based training program in DC. We do a 4-day pediatric hospital training course in Long Beach, California.
Okay.
So yeah, give us a call. Come check us out. Check out our website, healwell.org, and we'll love to hear from you.
Okay, awesome. Thank you very much.
Thanks, Ryan.
Now I want to be you when I grow up. Okay.